A major problem that many healthcare establishments suffer is false fire alarms. There are many reasons for these, but whatever the cause, they can affect the way people respond, interrupt the delivery of care, and they can have far-reaching effects in the community as a whole. Let us have a quick look at some of the problems that false alarms cause. Patient care is interrupted. Clearly this may have serious implications. Staff are disrupted and downtime is experienced while staff try to identify the location and prepare for evacuation. False alarms may cause distress to patients and visitors, especially if they are anxious about their ability to evacuate. And if staff are seen not to react because they know it is a frequent false alarm, confidence in the organization as a whole can be adversely affected. If staff become complacent due to frequent false alarms, then they may not react in a real fire. This could have dangerous consequences as valuable time may be wasted. Even worse, when staff continually experience the disruption of false alarms, they may be tempted to impede sounders or cover detectors. The consequences of doing this could be disastrous. And finally, a false alarm that results in a fire service response could result in the fire service being diverted from a real emergency elsewhere, with serious consequences for the community as a whole. Okay, let's look at some causes of false alarms and what we might be able to do to reduce them. You will all probably be familiar with the first false alarms from food preparation. Toasters and small cookers are the most frequent culprits. The simplest way to tackle this type of problem is don't leave any cooking unattended. Do not use toasters or cookers in areas not approved by the fire safety advisor. And do not wedge doors open, since this could result in cooking fumes activating detectors in adjacent spaces. Cleaning toasters and cookers regularly will also reduce smoke and burning smells. Aerosol sprays may also trigger a fire alarm when used near fire detectors. Ways to avoid false alarms when using aerosols are: avoid using them in confined spaces where detectors are fitted. Spray towards the floor in sluice rooms, cleaners' cupboards and so on. Use them sparingly and advise patients where they use them to spray away from fire detectors. Another common cause of false alarms is the accidental triggering of break glass core points with trolleys, cages and beds. These are really easy to prevent. Just by taking extra care to avoid hitting core points when rounding corners, we can significantly reduce disruption. Think about it, just pushing one trolley back against a wall carelessly may cause patients to be evacuated, the fire service to be mobilized, and even medical complications for some patients. If a particular core point is prone to accidental damage, it might be worth fitting a protective cover. Another common reason for false alarms is a combination of poor design and lack of care. Many buildings, unfortunately, have call points, door openers and other switches situated close together. It is often easy to operate the wrong one by mistake. This is due to the way trunking and service ducting was installed when the building was constructed, so there is little that can be done about the position of the switches themselves. If this is a problem in your building, please always take care to press the correct one. Again, a cover could be a solution if accidental triggering occurs regularly. The next common cause is really specific to those who work on the fire systems or perform duties that may specifically trigger a detector. Unauthorized people must never work on any safety system. It is essential that system procedures are followed to ensure areas being worked on will be disconnected during maintenance activities. Next, a cause of false alarms that many of you will have no control over: contractors working on site. Anyone who does work with contractors must ensure that precautions and procedures are followed to ensure false alarms are eliminated. Typical contractor false alarms are caused by not isolating detectors, starting work without checking requested heads are isolated, producing dust without covering or isolating heads, hot works being undertaken without taking all appropriate precautions, and finally carelessness when working around call points. frequent false alarms can be annoying and disruptive to everyone, whether patients, visitors, clinical or non-clinical staff. But no matter where you work, you should never assume that an alarm isn't real. If you do suffer from frequent false alarms in your area, then take ownership, find out why, and try to have something done about it. The solution might be as simple as clearly labeling the door switches so that patients and visitors know which button to press. Or it might be a matter of ensuring that doors are shut when food preparation is underway. If you need a protector around a call point, then ask for it. Always check fire repeater panels and make a note of the fault code. If you can't identify the cause, it may be the result of a faulty detector or sensor in a ceiling void where you can't even see it. The government, fire and rescue services, and all healthcare organisations are determined to reduce the number of false alarms that occur. As a result, all false alarms will be followed up, and if you can identify the cause, then that is a good time to ensure that appropriate action is taken to eliminate future problems. Finally, one of the most difficult false alarms to tackle is malicious triggering of detectors or call points. Being vigilant and reporting anything you see that looks suspicious may help prevent malicious alarms. You may even smell matches or perfume from sprays in the area of the detectors. If you do, report it. Deliberate triggering of fire call points may be reduced by fitting alarmed call point covers. These covers, when lifted, typically emit a 96 decibel local alarm, which immediately draws attention to the fact that they are being tampered with.